Bismillahirrahmanirrahim. Assalamu alaikum everyone. Welcome to my channel. Does knee pain make it hard for you to do even simple tasks like getting up from a chair or climbing stairs? You are not alone. Knee pain may affect every part of your life, making it difficult to stay active and enjoy the things you love, like walking, stair climbing, running, getting up from sitting, using bathrooms. But what if you could manage this pain right at home with some simple exercises? In today's video, I'll show you a physiotherapy home plan to help you manage knee pain effectively. Let's get started. The knee is a complex hinge-like joint, allowing you to bend and straighten your leg. It includes bones, cartilage, and ligaments working together to keep you moving. When any of these parts are injured or overused, you may experience knee pain. Before we proceed, if you have not subscribed my channel yet, please press the subscribe button and hit the bell icon. Now it's time to tell you some effective exercises that hopefully will help you in managing your knee pain. For acute pain, means if pain is just started, start with RICE method. It means take rest, avoid aggravating activities, then apply ice packs wrapped in a towel for 15 to 20 minutes 3 to 4 times a day. Use a light compression bandage to reduce swelling. Place your leg up on pillows to improve circulation and avoid swelling. Now, strengthen your knee by doing some strengthening exercises. Start with quad sets with towel. It strengthens your quadriceps. Lie on your back with one knee bent and other knee straight. Place a roll towel under the knee of your straight leg. Tighten the muscle in your thigh, quadriceps, and press the towel with the back of your knee down. Hold for 5 seconds, then relax. Repeat 10 times. Switch legs and repeat. Second exercise is short arc quad. It strengthens your quadriceps. Lie on your back and place a pillow or roll towel under your knee. Tighten your quadriceps or thigh muscle, then press the towel with your knee and move your foot a few inches up from the floor. Hold for 5 seconds, then relax. Repeat 10 times. Third is side lying hip abduction. Lie on your side with your hips stacked and bottom knee flexed or bent. Lift your top leg away from the bottom leg, keeping your hips stacked. Hold for 5 seconds, then lower your leg. Repeat 10 times per side. Fourth is VMO strengthening. It is a muscle that is located in the inner side of your thigh. Squeeze your inner thigh muscle, lift leg a few inches off the ground and rotate foot outward. Hold for 5 seconds, then relax. Repeat 10 times per leg. Fifth exercise is glute bridges. It strengthens your hip muscles. Lie on your back with knees bent and feet flat on the floor, hip width apart. Lift your hips off the ground until your body forms a straight line from your knee to your shoulders. Squeeze your glutes at the top. Hold for 5 seconds, then lower your hips back down. Repeat 10 times. Now do some stretching exercises. Calf and hamstring stretch with straight leg raise. It improves flexibility. Lie on your back with both legs straight. Wrap a towel around the ball of one foot and gently pull your leg toward you until you feel a stretch in your hamstring or back of the thigh. Hold for 30 seconds. Repeat on the other side. Then keep the leg straight and raise it towards the ceiling as high as comfortably possible. Hold for 10 seconds, then lower. Repeat 10 times per leg. Thank you for watching. Don't forget to like, share and subscribe for more health tips. Stay healthy, stay active.